Yeah, I'm Dr. Prem Nair, Medical Director at the Amrita Institute of Medical Sciences, which is part of the Amrita University here in Kochi, Kerala. Well, Kerala is a highly educated society, particularly probably boasts of the highest female education in anywhere in India, perhaps also in the rest of the world. Educated women access healthcare very effectively, and that's one of the reasons probably why Kerala has a very high healthcare indices similar to that of Western Europe. Also, the healthcare in Kerala has generally been excellent, particularly in the primary care, secondary care areas, because of the excellent infrastructure and network in all districts of primary and secondary health services. And this has been thanks to our government. This has always contributed substantially to Kerala's healthcare. Additionally, today Kerala can boast of one of the largest network of educational institutions in the healthcare arena, a large number of both private and public hospitals. Private hospitals are largely in the tertiary care area, and exceptionally high quality, fully accredited facilities abound in all parts of Kerala, so that healthcare access is fairly complete. Patients' awareness of a lot of medical conditions is exemplary, and there is a great deal of media attention to various healthcare problems that can be faced by the public, and this has improved the patient's access to healthcare in general. So overall, I think most importantly education, and secondly availability of healthcare infrastructure. One of the reasons for healthcare being so advanced in Kerala is probably the tremendous trust that people have in the allopathic healthcare system. Kerala, although it is still a stronghold for Ayurveda, it has served a very useful purpose in terms of providing palliative care and as well as chronic care in a number of settings, and that's also something that is very pronounced in Kerala. Well, the Amrita Institute really has set a new standard. We are about 18 years old, and when we started, the infrastructure in healthcare was somewhat antiquated, I must say. Most of the hospitals had just 4 cement walls and a metal bed. From that time onwards, within a fairly short time, AIIMS came in with a set of standards equivalent to that of the West, and that has facilitated excellent quality care, particularly in the tertiary care area, with standards set for operating rooms, intensive care units, patient care wards, laboratories, radiology, and so on. And this and also the hospital design and healthcare facility design substantially improved following the initiation of AIIMS back in 1998. Amrita Institute has a unique architectural design. Since we have both the tertiary care facility as well as primary care medical college facility, the tertiary care center is designed in a manner in which tertiary care outpatients area are linked at the same level with inpatient services. The outpatient services are concentrated in one tower, and the emergency services as well as the critical care areas, operating rooms, surgical recoveries, laboratories, and radiology are all on a critical, are all on a single level. And this facilitates care of patients transitioning from the operating room to the ICU and to the ward. And it also minimizes faculty and staff movement, which saves on cost, and also improves patient access. So that is a unique design. We have also included a medical college which is linked to the tertiary care center. The medical college hospital has both primary care as well as secondary care, and it is linked to the medical college so that there's easy access for the students in the medical college to the hospital complex. All of the critical care, operating room, ICUs are common facilities for both the medical college facility as well as for the tertiary care. And this provides uniform standard of care to all patients, whether they come to the medical college setup or to the tertiary care setup. The same faculty takes care of both facilities. Well, Amrita's focus has always been on low-cost, affordable health care. And affordability of health care typically comes from adequate utilization of all of the resources. So, utilizing resources, increasing throughput of patients and procedures through every technological modality helps reduce the cost per patient. For instance, if we are able to use a CT scanner or an MRI scanner 18 hours as opposed to 8 hours, the cost per scan is substantially reduced. So every effort is made to contain cost by rigorous, protocolized, evidence-based medical practice. And that allows us to minimize the cost of clinical service. Unfortunately, technology keeps advancing, and unless we keep pace with it, you cannot maintain world-class quality of care. Undoubtedly, the costs will increase over time, but again, by ensuring that we increase the awareness of the public to some of the advantages of technology, we are able to keep the utilization at an optimum level and keep the cost down. Again, technology needs to be such that technology needs to be very appropriate. You could have a very high-end CT scanner, but you need also the mid-level and the lower-level CT scanners, because a number of disease conditions does not require a very high-end 500 slice CT scanner. So we use the high-end, high frequency, high rotation CT scanners for appropriate indications only. A 3 Tesla MRI should be used largely for functional MRI and some of the neurological and spinal problems, but not for routine joint scanning, or some of the routine scans does not require us to use very high-end scans. That often doesn't happen in many institutions where high-end scanners are used routinely at a very high cost. So we can cut costs by judicious utilization of costly equipment. Well, as you know, today in India, a lot of the medical devices are still imported. We are dependent on imports of US and European for diagnostic purposes. So oftentimes when we are faced with the purchase of costly instruments, we are able to negotiate with the company to provide academic and research support and partnership along with the instrument that is purchased. For instance, a digital pathology equipment, one can work with the industry to provide consultations at low cost to peripheral hospitals through an IT link, through telemedicine and provide telepathology services that will provide low-cost services to the community, and at the same time will give us the necessary bandwidth in terms of utilizing such a costly machine. Digital pathology can also link up major centers in the West, and our pathologists can provide the necessary expertise which would contribute to foreign exchange income for India. We can also work with the industry to provide indigenous engineering support, in the sense that there is technology exchange, use of some of the costly equipments, either components or entire equipments, can be made in India for the global market, and this will help reduce cost for the Indian population. Most of the technology exchanges are carried out such that the Indian market is protected and provided the same equipment at a much lower cost than it is for the global market. So it's a win-win for both the industry as well as the hospital and the local industries. We are very unique in that we have a very high quality tertiary care center and a very, very active healthcare education program, including not just the medical college, but also dental, nursing, pharmacy, a very large allied health sciences program. So this is unique in that we have over 2,500 students on campus at any given time, and they provide the resource in terms of skills, and many of these students go through a rigorous healthcare simulation and skills development program that provides us the necessary human resources to maintain our facility. As you know, healthcare human resources are very scarce in India. Today we are facing an extreme shortage of healthcare resources. So the students on campus go through a rigorous skills development program during the first 6 to 12 months that they are here, which allows them to move into the clinical arena and provide services at a certain level, and this facilitates improved quality of healthcare. Again, research is one of our prime efforts. Again, we are probably one of the very, very few hospitals in India that has put in a large research lab in the middle of the hospital. It is extremely rare, and the reason why we did that is because we are able to attract clinicians into the research area and participate in medical research. Research is also very interdisciplinary, and we have been able to bring biology, medicine, informatics, and technology all on the same platform to productize whatever research is completed, so that low-cost devices, low-cost diagnostics can be brought in to the Indian market. I think the skill gaps in India is so huge that it's not possible for a single institution to participate, but we have been working with the government of India and is a part of the task force for development of allied health sciences. We have worked with the government to provide the syllabus and curriculum. We have given the formats for a variety of allied health sciences which are critical for modern hospitals to run. Our own allied health science program, as well as the clinical sciences program, is very large, and this has formed a kind of a template that we can scale up for the rest of the country. Well, I think when we practice medicine, we need to practice medicine holistically, in the sense that we need to look at prevention, we need to look at early detection and curative services in healthcare. For those who are chronically ill, palliative and home care are another important area. We have one of the earliest palliative care services in the state. and we have a very, very active home health care. Additionally, we have an Ayurvedic college, and we are very active in integrative medicine, which again provides holistic care by bringing in the best of a variety of disciplines, which includes allopathy and Ayurveda, as well as yoga, Siddha, and Unani. All of these services and disciplines are represented here in our institution, as well as our Ayurveda college in Kollam. Well, we are in the process of building a 2,200 bed super specialty medical college hospital in Delhi. A hospital is also planned in Hyderabad, in the new Seemandra Amaravati area. The expansion plans involve development of medical college hospitals in major metros. We have a plan and we are just about to start construction of a 2,200 bed hospital in Delhi NCR at Faridabad. Another hospital project is planned in Amaravati at the Seemandra capital. Bangalore, we have a medical college hospital planned. We've also started our foray into rural health, and we have adopted 108 villages throughout India, from Nagaland to Nagarkoil. And these villages are planned as holistic development projects where social aspects, social determinants of health are also addressed in addition to healthcare of the villagers. Most of these areas are located in backward areas, tribal areas, where we plan to set up healthcare facilities and provide primary healthcare in a manner in which it is sustainable. So this is an experiment that we are involved in collaboration with each of the state governments, and we hope that it will provide a roadmap for scaling up for the rest of the country.